This is gonna look a little uncomfortable, but I wanna show you that the nose is a very, very special place. The nose does not go up, it actually goes straight back. And when you take care of a deviated septum, this is what I want. I wanna be able to put my suction all the way back and not hit anything. And as you can see, you go about this far, so she now will be able to breathe. I'm Dr. Dhir, a facial plastic surgeon in Beverly Hills. I want to show you my patients are real people who want natural results. Rhinoplasty procedures, also known as nose jobs, are one of the main procedures that I perform in my office practice. It's something I'm very passionate about. And as our series goes on, I'm going to show you different rhinoplasty patients, and I want to discuss the reasons why they undergo this procedure. Today, here is one of those patients.
My name is Orit. I've been in LA for a long time, like 20 years. I'm originally from Israel. I'm Jewish and I've always had this nose. But the older I get, like I look at pictures and, I tend to not do profiles anymore because it kind of bothers me a little bit. So that was kind of what I was looking for, maybe just to kind of balance it out a little bit with the rest of my face. I got married just a couple years ago to my wife, Mia, and just recently she gave birth to our first boy. So we've been sleep deprived now he's 6 weeks old. So for 6 weeks, we barely have slept. Now is the time to think about us a little bit and, make us a little better, a little nose job. Why not?
Hello, Reed. How are you?
Hi.
I'm Dr. Dhir.
Nice to meet you.
Welcome to the office.
Thank you.
Thanks for coming. How you feeling?
Nervous?
Nervous? Oh, that's completely normal. It does take a lot of strength to come here, so I'm impressed. So welcome to the office. It sounds like to me that you have a story or something on your mind because you are in front of people, you have a great job, you're doing well, you have a family.
Right.
So everything's kind of going well for you. Is there something on your mind that you want to talk about that maybe something's lacking in the confidence section where I could kind of help?
I mean, I think it's not so much confidence as far as like professionally, but like when I present myself, I've always felt like my nose has been a little bumpy, and so when I take pictures, I always try to make sure that I face the camera. I don't really face sideways because, the profile to me has always been a little bit off. It never really bothered me to the point where I felt like I wasn't comfortable in front of people, but internally I always thought, well, I could, if I only had a nose job,
Right.
I would feel like so much better.
Right. Do you have any breathing problems that go with the nose?
This is interesting. So I used to say no, but in the last year, apparently I started snoring a little bit. And I can tell on the right nostril that it's definitely when I breathe in, it's not as full as when I breathe out on my left.
Left side, okay.
This is in the last year, so I don't know what the difference is.
So let's first look at the nose. So when we look at the nose, I first want to see how it harmonizes with the rest of the face.
Okay.
With that in mind, so we have the nose, you're telling me that's lumpy, bumpy. So
Yeah.
you've already kind of told me some tricks that I already know what you want. If I were to do this nose, side profile-wise, we have a little bit of a hump
Yes.
that makes it look more of a beakish type of
We used to call it the
appearance.
beaker.
The beaker. So if I were to do this nose, I would I would take down this dorsum, we call it, or the hump.
Right.
And I'm really very conservative.
Yes.
If I put my hand like this, you see that I like to go straight or a little bit less than that, but anything more than that, get a scooped look. I personally
I don't like it.
do not like a scoop look, but however, it doesn't look bad on people. I personally would rather, if you're okay, stay exactly straight or maybe a little bit less, but for females I like to kind of stay straight. And then because this is beginning to fall a little bit, this tip has to be supported, and I will lift it ever so slightly.
Okay.
And what I mean that is what it is that if I take this hump out, it will fall more. So I want to support the tip outward so that it has a feminine elevation and it's refined and has a little bit of strength to it.
Okay.
With that, I do not want it to be too high and have a pig-like appearance or people are looking in your nostrils.
Yeah.
That's what people always ask me. It will not happen.
Okay.
With doing that as well, see how this hangs?
Yeah.
This will elevate ever so slightly.
Okay.
And with the small hump removal and tip refinement, those are the three things I would personally do for your nose, and that is all. And that will match with the rest of your face.
That sounds exactly what I was looking for. Yeah, it's like spot on.
So one of the things that I always like to evaluate for the breathing purposes is that breathe very hard. It's collapsing on the right side.
Yeah.
So that actually tells me that she has a deviated septum to her left, and she has to suck in so hard that on the right side, her valve begins to collapse. So during the procedure, when I straighten it, that'll improve the airway on her left, And then I'll also have to support her airway, her nasal valve here with some cartilage. So when I lift her nostril, I put something here to support it. So now breathe. It'll hold it supported.
Yeah.
How's that
Better?
feel? Mm-hmm. Okay, so that'll be your functional part
Yeah,
of your
that's
breathing.
always collapsed, that left side, the right side.
So we'll improve that collapse with the procedure.
Okay.
Okay?
Wow, okay.
All right. There are a lot of reasons why a patient would want to undergo a rhinoplasty procedure. Sometimes it's just for aesthetic concerns, and sometimes they want to correct an issue. In Orit's case, she not only wants to reshape her nose, but she has a deviated septum. And I want to make sure I fix both of those during surgery.
Today's my surgery day. Today I get my nose fixed, and hopefully by next week I won't be snoring anymore either.
On the day of surgery, I make sure to go over our plan one more time with my patient, just to make sure we're still on the same page. And then I explain what they can expect post-surgery. I just want you to be aware, when you wake up, you won't have any memory of anything, you won't have any pain,
Okay.
but you're gonna have a cast on your nose and know something happened. And there's a little discomfort that comes with that, okay? So you're gonna have a cast on your nose, you're not gonna be able to breathe through your nose, which you already kind of don't because you have that deviation. But if you feel anxiety that you can't breathe, just say 1, 2, 3. If you can hear your voice, you're able to breathe through your mouth, and that's fine, okay? When you have the cast on your nose, you will have a little bit of bruising under the eyes, a little bit of swelling. We're gonna put ice on there, but just be expecting of that, okay? And then we head into surgery. I'm leaving the good hands of Dr. Siegler. She's the best, okay? Sleep tight, okay? You'll see me in about 2 hours, all right?
Okay.
Sleep tight. So she's now asleep, she's comfortable. We're about to start our rhinoplasty procedure. We're gonna focus on the things that we discussed at the pre-operative consultation, which is number 1, take down the hump. Number 2 is refine the tip. And 3 is we gotta support it forward. And of course, wanna make sure that she breathes well. So we're about to start. Okay, so when we do breathing surgery, which is the deviated septum, the septum is our middle kind of spongy thing that we can feel and wiggle in our nose. This should be totally straight. As you can see here, this had a little bend or a spur, we call it. So I had to take this out, so now that she can breathe. Before, when air would come in, it would hit this. It's kind of mild, we've seen bigger, but on her, this was the deviated portion. So we've taken this out, and now she's gonna have a straight nose to breathe. So we've done the septum, we did a full transfixion incision. Here's the caudal septum. Next we're gonna make intracartilaginous incisions, and we're gonna make the incision here and connect it to our full transfixion incision. You can use an open approach or a closed technique, both are the same. Here's the upper lateral cartilage. I have a skin hook, retracting it back. You wanna make this look like an open procedure as close as you can. So you wanna go down to cartilage, and here's the upper lateral cartilage here. You can connect it to the full transfixion incision, which you'll see in a moment. And I'm spreading right on top of the cartilage. And it's a bloodless plane. Rhinoplasty should be as bloodless as possible. Go ahead. Go ahead. Go ahead. Go ahead. Good. So here's the bone. This is the hump that people come in for rhinoplasty. So I've taken this just a little bit of bone, which is the hump right here. All right, so here's the septum, the cartilage from the septum. There's different places we can get cartilage from. You can get it from the ear, the rib. I like to take it from the nose if I can, which is where we're working on, so we don't have to make other incisions, but every nose is different. So this one, we actually got a nice piece of septum. I took out the deviated part, but I took out a little bit of straight part, and this is the cartilage here. And we can use this, take the patient's own cartilage, and recreate the tip, support it, and we can use their own cartilage. And so that right now we're gonna do is make some grafts. And we'll use our little knife, and we're gonna whittle it away, and we're gonna make it a little artistically fun.
I am so excited. I can't wait to, 1, get the cast off so I can breathe, and 2, to look sideways and see the profile. I can't wait. I can already tell the difference.
It's been a great week. You did a wonderful job. How did it go for you?
Fine. Like it was, the first couple of days were just a little achy and stuffy, and the nose was draining constantly. That was so annoying. I had a day of sneezing. I got past that, and everything else has been fine.
How about discomfort, like pain?
It's not really painful. It's more just pressure and then itchiness. Like the last 2 days, it's been itchy underneath the cast.
That makes sense.
So you can't really get to it. So, but not really pain.
There's going to be 3 steps, okay? Number 1 is I'm going to go inside and take out the splints first.
So there is something inside.
There's small rubber things that hold things straight,
Okay.
I'm going to take those out first, and then I'm going to do a quick clean with the suction. I don't want you to breathe through your nose at all.
That was it?
Okay, that was it. Now we're just going to clean a little bit. Good. Okay. Now, you can close your mouth and take a deep breath through your nose. There you go. Welcome back.
That was worth the tears.
There's the tears.
Yeah.
Like I said, there's always worth tears. So breathe better than before surgery.
Wow.
And
It's like, I mean, it feels like, I can't even tell you. This is like the best breath I've ever taken in my entire life.
Second step is I'm going to numb your nose with a spray so I can do the deep cleaning at the end. A little numbing medicine now. You breathe in. Good. This will help me clean you up a little bit more. Great job. And then number 3, we're going to take the lovely cast off. That must feel better.
Yeah, every little step feels better.
It's like the glue remover. Okay.
Okay.
All right. I'm going to do a little bit more touching and feeling just to make sure I'm happy with
Okay.
everything.
Are you ready, Orit?
I'm ready.
Dr. Deer, you ready?
I am ready.
Okay. Oh my God, it is so perfect. I love it. I love it so much. Oh my God, it's great. This is like better than I thought it was going to be. This is unbelievable. It's swollen and to me it looks perfect. Thank you so
You're very welcome,
much. Oh my God. This is so great. Oh my God, I can't believe it. All this time I waited and now it's perfect. Thank you.
You're so welcome. So Orit's response to her reveal is the exact reason why I do this job.
It's been like 2 weeks since the bandages came off, and the swelling is like completely, I feel like it's down. I love my nose the way it is right now. I guess the swelling's supposed to go down even more, so we'll see. My breathing has completely changed. I can definitely breathe out of my right side. I didn't realize how little I breathed out of my right side, and now that everything is open, the pathway is open, I'm shocked basically. Every time I take a breath, I'm really surprised.
Hello, Orit. How are you?
good.
Welcome back.
Thank you.
So good to see you.
Me too.
So we're at 3 weeks now,
We're at
huh?
3 weeks, yes.
We're in a good spot where things are kind of going to start to settle, but tell
Yes.
me how things are going for you.
They're going great. No complaint,
Making this easy.
Yeah, it's a little numb, or stiff, or whatever you want to call it.
Yeah.
But otherwise, it feels great. Every day I look sideways in the mirror, and then I look back and forth, and I just can't believe it. Like I wake up every morning, and I just can't believe it.
You're making me feel very, very proud, and I'm humbled, and kind of, if I was not brown, I'd be blushing. What I'm seeing though, and what I'm going to be monitoring is that it is swollen here
Okay.
and here. The skin needs another week to 2 weeks to kind of get to 80%, and then over 1 year, you can see
Right.
small changes. But that's what I'm going to be watching here. Until your nose does this,
Yep. It's not completely
it's
healed.
not done.
I'm so happy with it. Like honestly, I don't even notice the swelling. Like I know it's supposed to be there, and I look in the mirror and I'm looking for it. But to me, the nose is perfect.
Oh, no, that's
Yeah.
that's the best thing to hear when a patient's happy.
I always think that people come into your life sometimes for a short period of time, and they really change your life forever. And I think Dr. Deer is one of those people that, even though he was in my life for a brief moment, he really changed my whole life and really changed my perspective on my future.
I'm so happy for Orit. Her nose is healing exactly as it should. And not only does it look great, but she can breathe. I really love when I can help a patient feel more confident and enjoy life even more. Thanks for watching this episode of Plastic. Follow me on social media, and I'll see you soon.